Good morning, everyone. I'm Alderman Walter Burnett, Alderman of the 27th Ward. Welcome to the 27th Ward. You're actually here at one of the gyms in our ward. Greater Westtown is a great organization to give young people a second chance to get their education, but also give adults and young people an opportunity to get a skill that they can take with them and get employment. You know, today we're here because it's only fitting that we're here today to give people another chance. Today we're talking about giving people a chance to live, right? And we have a person today who know how to utilize any and every resource that she gets to help people in our community all over the city of Chicago to be able to sustain themselves in these times. Ladies and gentlemen, I'd like to introduce the Mayor of the City of Chicago, Mayor Lori Lightfoot.
Thank you, Alderman Burnett, for that, and good morning, everyone, and thank you all for being here. I want to start by acknowledging and thanking the leaders who are with us today, who've come together to invest in the next step in our citywide response to COVID-19. You heard from Alderman Walter Burnett. Also with us is Alderman Rod Sawyer, who is the chairman of the Health Committee. Chicago Cook Workforce Partnership CEO Karen Norrington Reeves, Chicago Department of Public Health Commissioner Allison Arwady, and the Greater Westtown Community Development Project Executive Director, Keisha Davis Johnson. Thank you all for being here and for your support of this important initiative. Today's announcement is truly rooted in our values of equity and inclusion, values that continue to guide us in our response and recovery from COVID-19, which has left a devastating impact on our economy and our communities, and especially our communities of color and our vulnerable residents, low-income, Black and brown residents. This pandemic has left people without their jobs, the very thing that they need to keep the lights on and the food on the table, and having them instead living in fear of catching a disease that would leave them even more vulnerable. As a city, it is our responsibility to ensure that all residents, regardless of their circumstances, have access to the resources they need to feel safe and supported during these uncertain times. That's what makes today's announcement so important. Contact tracing is a core part of our COVID-19 response. It truly has been from day one. And today's announcement has two important components. First, with the selection of these community-based organizations, we are exponentially expanding Chicago's contact tracing capacity. And Dr. Ari will talk more about that. I want to remind folks, COVID-19 is still here. We need to continue leaning into the important public health tools that have gotten us this far to be able to even talk about the possibility of a recovery and a life post-COVID. And contact tracing is one of those essential tools. Also, with the contact tracers that will be hired, we are also substantially augmenting a community health core, a healthcare core for now and in the future. 31 community-based organizations have been selected to hire individuals directly from neighborhoods of high economic hardship to staff our first ever community-based contact tracing core, which will not only support our ongoing response to COVID-19, but generate much needed jobs, as well as potential future career pathways. The Corps will work hand in glove with the Resource Coordination Hub to refer diagnosed individuals and those that they've sustained contact with to testing, treatment, and other resources, and create roughly 600 full-time jobs and part-time positions, thus helping slow the spread of COVID-19 and giving residents in economically distressed areas stable employment opportunities. However, in a time marked by uncertainty, it isn't just enough to give people what they need to get by. We must give them the tools that they need to stay afloat, to invest in themselves, and succeed for the rest of their lives. Job creation, which is what this initiative does, is a key first step. This initiative will provide the next step by offering real career pathways into healthcare through professional development and opportunities to gain credentials. These resources can lead to permanent placement into the healthcare community, thus giving our residents a chance to earn and learn so that they can grow professionally and reach their highest potential. For all of those who are interested in taking advantage of this opportunity to get in on the ground floor to be a contact tracer, you can apply right now at shytracing.com. That's shytracing.com. I want to take a moment to underscore that this is a contact tracing model unlike any other in the country because of our partnerships with these community-based organizations. As a result of this direct investment in our community members and their career pathways, we can expect to strengthen our communities in the next 2 years. Once again, I want to thank the partnership and their partners for their hard work and collaboration on this initiative. In order to emerge from this pandemic as a better, more equitable Chicago, we need partners like the ones that are part of this initiative, who have the pulse of their community's needs. And we will stop at nothing to ensure that those needs are met by empowering residents to build out the bright futures they deserve. Thank you all again. Thank you for the work that's already been done. Thank you for the work that will be done. And it's my pleasure to welcome Karen Norrington Reeves of the Chicago Cook Work Partnership to say a few words.
Good afternoon, everyone. Thank you, Mayor Lightfoot and Alderman Burnett. It is truly my pleasure to be here today to talk about the role that we at the partnership have been playing in helping to create the city's COVID contact tracing core and resource coordination hub. For those of you who may not be familiar with the Chicago Cook Workforce Partnership, or the partnership as we're known, we are a nonprofit umbrella organization operating the public workforce system for the city of Chicago and Cook County. Given the pandemic, you've heard a lot of talk about the public health system now more than ever. Well, we are its counterpart. We are the public workforce system. The partnership combines federal and philanthropic resources to provide comprehensive workforce development services to employers and job seekers alike. We operate the largest nonprofit workforce development system in the nation. We are proud, as I am personally, to play a role with respect to this COVID contact tracing core. This is an initiative that accomplishes two very important goals. First, it provides residents jobs in high-demand healthcare sector. And secondly, it helps to stem the tide of the pandemic in our communities. In July, the partnership received a 2-year, $56 million grant from the City of Chicago and the Chicago Department of Public Health to serve as the lead coordinating organization overseeing this very important initiative. For the past 2 months, our team and our partners have worked diligently to manifest the city's and the CDPH's vision to select community-based organizations that will hire and supervise the contact tracing core. The core will be made up of roughly 500 tracers and supervisors, and they will all be hired by Chicago community-based organizations. The tracers and the supervisors will earn $20 and $24 an hour respectively, and can work either part-time or full-time. Most importantly, the tracers will work for community-based organizations in or near the communities, their own communities, performing this critical work in the neighborhoods that they call home. But it does not end there. Our vision at the partnership is broader than a temporary job. We are looking beyond the pandemic and looking at the future labor market and the future economy. While the contact tracing jobs meet immediate needs, they have the capacity to meet the future needs of both community members and the private sector. As the mayor mentioned, the partnership is working with our partners and many stakeholders to offer the contact tracers ongoing professional development and an earn and learn opportunity designed with input from public health experts and private sector institutions. Through the Earn and Learn program, participating contact tracers will be able to gain market-driven credentials and permanent placement in allied health and adjacent occupations at no cost to them. And that cost is actually funded by federal dollars outside of the $56 million grant. The selected community-based organizations vary in size and nature, but they are united in a common goal: service to Chicago's communities. Service to the man who was laid off in April, who's struggling to feed his family, service to the woman who is in need of housing, and service to the young adult who is seeking a career path. We received more than 70 proposals from organizations wanting to participate in the Contact Tracing Corps. We chose 31 community-based organizations because they are located in or serve the communities hardest hit by the pandemic, and because these organizations excel in their respective civic missions, and finally, because they are capable of meeting this challenge in this moment. In fact, just last week, we had our first virtual orientation for all of the awardees, and their enthusiasm and excitement and passion for this one-of-a-kind program came through loud and clear. So we're ready. We are ready for this challenge. To ensure the success of this program, we have enlisted an all-star team of public health leaders with significant expertise in their respective fields. They are the University of Illinois at Chicago School of Public Health, Malcolm X College, one of the city colleges of Chicago, Sinai Urban Health Institute, and NORC at the University of Chicago. Finally, I would be remiss if I didn't acknowledge the outstanding team at the Chicago Department of Public Health. Dr. Arwady, we are honored to align the public health system with the public workforce system for the first time in recent memory. Together, the Chicago Community-Based Contact Tracing Corps and the Resource Coordination Hub will bolster the already underway efforts to stem the transmission of COVID-19 in the city's hardest hit neighborhoods. We at the partnership are proud to provide workforce development services to our city and communities through this unique initiative, and we look forward to supporting the 31 community-based organizations as they begin hiring local residents for the contact tracing jobs. I'm also pleased to announce that we have already had 150 conditional offers of hire extended to prospective contact tracers, so they are ready and set to begin training. Now it's my pleasure to introduce Dr. Allison Arwady, our esteemed Public Health Commissioner, to further discuss this initiative. Thank you.
Thank you so much, Karen and everybody. So we are so excited about today. This is something that the Chicago Department of Public Health put forth as a vision way back in March and April, when we had the opportunity at the federal level to say, what should contact tracing look like? We said, if we're going to get significant funding, we want to use that funding in a way that will, first of all, support communities, particularly communities that are most in need of jobs, and secondly, that will allow us to think beyond COVID. I hope by now you've heard me talking a lot about our preparedness. It is our job at the health department to, of course, address the issue of right now, of making sure that everybody is getting the appropriate case investigation and contact tracing. That is something we have been doing all along, and it is something that will continue as we bring these new partners in. But it is also about thinking beyond COVID. We want to build further opportunities for public health and for healthcare in the neighborhoods where we regularly see public health disparities. This has come to light with COVID, but it's not different than what we've seen where we look at chronic diseases or infant mortality or opioid overdoses. The ability to have additional community-based public health partners, we think, will allow us to grow a more inclusive, more community-driven public health system for the long term. I do want to make the point that this new investment is not the only investment happening related to contact tracing. In addition to this major piece, Chicago Department of Public Health is funding to the tune of another $14 million healthcare partners to help with the case investigation side. So that includes our federally qualified health centers here in Chicago. We're lucky to have 22 systems. We offered all of them funding if they were interested to become part of the case investigation side. 19 of them took us up on that, and they will be getting some additional funding to help support on that side. In addition, we're supporting 9 of the ambulatory and community health network clinics of Cook County, the ones that are based here in Chicago that have missions very similar to the FQHCs. And finally, We offered additional case investigation support to hospitals that had done a large number of testing and had had a high % positivity. So we also have 8 hospitals who are receiving funding. So in addition to these community-based organizations, the clinically based organizations, and the continued work of the Chicago Department of Public Health, I am extremely confident that we will not only sustain the strong case investigation and contact tracing that we've had to date, but we will actually be able to improve on our metrics, to have more opportunities for engagement at the community level, and more opportunities, frankly, to build trust with Chicagoans who sometimes still wonder about the ways in which we are using their information. I do want to also talk you through just quickly how case investigation and contact tracing works, and give you a sense of some of the metrics of where we are as a city right now and what we'll be following going forward. So first of all, the Chicago Department of Public Health every day receives the test results for any Chicago resident who tests positive for COVID. And every Chicago resident who tests positive for COVID gets case investigation and contact tracing, and will continue to get case investigation and contact tracing, regardless of their address. If that information is missing the contact information, sometimes we get a lab report that doesn't have a phone number or an address, for example. We have to divert that to another team that needs to investigate. Also, if there are delays in terms of when we are receiving some of those test results, we have another team that's working on that. But broadly, the ones that come in, we work to assign to our case investigators. And all the way going back to June, at both the state and the city level, we set a goal of being able to begin the initiations, the investigations, to assign these to our investigators within 24 hours of having received the report. That's a sign of, do we have enough staff? Do we have enough capacity? I'm happy to say that we have managed to hit that 90% mark. Last week, for example, 89% of the cases that were assigned within 24 hours of receipt, and we've ranged between 84 and 93% going back over the last 2 months. We will continue to track that and build it with these new partners. Secondly, those case investigators then begin contacting the cases. And this can be a multi-step process. It takes multiple calls, it takes letters. Sometimes people need to call us back. There's a long process that happens, sometimes to build the trust and to make sure people feel comfortable sharing information. We want to make sure anybody who's had COVID-19 is connected to appropriate clinical care, has the support that they may need for isolation or quarantine or food or housing or anything that helps make sure public health stays first. So with that, across the country, we've seen anywhere from about 40% in that range to about 70 to 75% completed case investigations, where we're able to get the full information. We have a goal here of having complete full case investigations at least 70% of the time. Last week, 57% of our case investigations were fully completed. We've ranged between 57 and 63% over the last 2 months. So some room to grow there, but very much in line with what we're seeing across the country. And again, making use of trusted healthcare partners and community-based partners is one thing that makes us confident we'll be able to even further improve on some of those metrics. And then finally, the investigators work to identify case contacts, particularly outside the home. This is the work of the contact tracers. We protect privacy. We don't share the individual information about the case who's been diagnosed, but we reach out and say, you know, we have reason to believe that you have been exposed to COVID. Here's what we need you to do. We need you to get a test. We need you to be quarantined. What information and what resources do you need to do that successfully? Our goal is to identify a named contact with contact information, particularly outside the household, at least 50% of the time. Last week, 55% of our case investigations were eliciting those contacts. We've ranged between 49 and 55% over the last 2 months. So, in addition, as we bring all of these partners together, we've needed to build a lot of new technology platforms to allow us to do this effectively. And this will be another new stage as we make sure that we are keeping privacy first and foremost. Your information will remain protected. We also felt it was important That, for example, if you are getting a call, whether it is from a community-based organization contact tracer, whether it is from the Chicago Department of Public Health, because we ourselves will remain involved for any of the location-based outbreaks or anything that is a little bit out of the ordinary. We're doing some hiring ourselves as well. Or whether you're receiving a call related to case investigation or contact tracing from one of our health care partners. We wanted those calls all to come from one number, right? And so as part of this, we will be launching a new tech platform. I can tell you that the number will be 312-74-COVID or 312-742-6843. That will be one number that you will be seeing on your phone. We're working to have it also show up where we can as a written Chicago contact tracers, but it will also be a single number that you'll be able to call back to, because we know there are people concerned about scams and, are you really a contact tracer? It will allow us, this is an example of how all of these different partners will be coming together with one approach. So it's our job to think ahead. And as we are heading into the fall and into the winter, I don't completely know what COVID is going to look like here in Chicago. We're concerned about the potential for surge. We're concerned about the potential for impact on our healthcare system, particularly where we see overlap with the flu season and other seasons. Now is exactly the right time to be bringing these new partners into our approach. We'll be learning from this process, we'll be building on it, we'll be adapting it as we need to. As you heard the mayor say, this is really unusual. Chicago is taking a different approach here, and thanks so much to Karen Norrington-Reeves and the partnership and everybody involved in thinking through this creatively. We want our COVID response to outlive COVID in all of the best ways, and we think this is one of the best ways to make a start on that today. So please, if you get a call related to case investigation and contact tracing, ask the questions, give the information. We do not share that information with the federal government or with anywhere outside of the public health system, and more will be coming. But know that the people on the other end of the line will increasingly be folks from communities, from your trusted healthcare partners, and still from the Chicago Department of Public Health. So it's a great day, and I am very excited to bring up Keisha Davis-Johnson from the Greater Westtown Community Development Project.
I feel like that deserves a applause.
So, on behalf of Greater Westtown Board, community residents, and staff, we are excited to be selected by the partnership as one of the CBOs to be hired and employ individuals for Chicago COVID Contact Tracing Corps. The mission of our organization is to build community-based response that expands educational and economic opportunities for disadvantaged residents for Greater Westtown communities. We have been serving Humboldt Park, Austin, North Lawndale, and East and West Garfield Park neighborhoods for over 30 years. All are low-income communities of color that have suffered disproportionately high rates of unemployment, underemployment, tied to a long history of unequal opportunities and community disinvestment. The impacts of COVID-19 has reverberated the world, and they have been especially devastating in our service areas. The pandemic has continued to expose the long health inequities in our country. The West Side communities have become hotspots for COVID-19, with Black and Latinos being impacted at an unprecedented rate. Many of our local businesses have shut down, and those that remain open are struggling significantly. The loss of jobs, income, and health insurance due to the pandemic have left many of our residents vulnerable to falling further into poverty. In a time where we have seen institutions waver, we feel fortunate to be a part of a city and state that are listening to the experts and leading by example. Our agency is grateful to take part in contact tracing program because it allows us to expand our mission by increasing educational economic opportunities for youth and adults significant with barriers to employment. By taking on the role of contact tracing partners, we can provide critical jobs and job training opportunities for residents in high-demand health sector, while rising to meet new challenges that our communities face in these unprecedented times. So many are struggling, not just with the fallout from the ongoing pandemic, but also because it's hard when you feel like you don't have the means or you don't know how to help. This program not only serves community, city, and state health needs, but just as importantly, it allows people who have been historically disenfranchised to take part in jobs where they would never have to doubt the value of their work nor their contribution to the community in this time of exceptional need. For all of us, especially now, it is important to be a part of something that is larger than ourselves. On behalf of Greater Westtown, our contact tracers, and all those who will experience the future ripples of this critical program, we want to say thank you. Thank you to Mayor Lightfoot, the partnership, Chicago Department of Public Health for providing us with this opportunity. Thank you.
I just want to say that I hope the big takeaway from today is this is really about a moment of hope. It's about making sure that we're doing what we need to do and have the infrastructure to continue pressing in our response to COVID-19. But I think it's also a moment where we are creating opportunities for good jobs with benefits for people in communities that have been hard hit, not just by COVID-19, but by disinvestment for years and years and years. And I want to emphasize the point that was already shared and Dr. already hit. This isn't just about today. This is about creating a community-based healthcare core for the future. One of the many lessons that we have learned through our response to COVID-19 is that what we need to be able to reach people who are most deeply impacted by healthcare inequities is trusted community voices. Trusted community voices to reach out, to educate, and connect them up with services. And that is our aspiration, and I'm confident will be a big result of the investment that we are announcing today. And with that, I'm happy to take your questions.
Mayor, can you tell us what kind of qualifications? It's one thing to hire people, but you can't just hire anybody. What do you need to get this job?
Well, we are, and I'll let Dr. already get into the specifics, but the point of this job is entry level. We're taking people who may have prior work experience, may not have prior work experience. What you need is this desire to learn and a desire to serve people in this capacity. These are $20 an hour plus benefit jobs, which is a good paying job. And really what we're doing is taking a lot of raw talent and shaping it so that they can become contact tracers. Dr. Artie, you want to, or Karen?
So they have to be 18 and over. We really would love to have people who have a background in customer service, because this is about being able to not only convey information, but receive information from people. We need folks who have a level of empathy and compassion, because you're going to be talking to people and telling them that they have been in contact with someone who has this dreaded disease, and you don't know the circumstances of those individuals that you'll be speaking to. And so one of the things that we've talked about is creating trauma-informed care and self-care support for the contact tracers, because you're going to be hearing stories from folks who are food insecure, housing insecure, employment insecure. So you've got to have some level of empathy and ability to have strong interpersonal skills and strong communication skills. And really with that, we will give them all the training that they need with respect to epidemiology, with respect to, they will go through an actual certification process through Malcolm X College to obtain a contact tracing credential. And it is a 12-hour program. I should also add that we are doing every 6 weeks professional development so that we're refreshing their skills and then layering on additional skills. So as long as folks are coming to us with some basic capacity for that interpersonal communication, we will then add upon the skills that they need and develop them to really be solid in performing the job. But minimally 18 and up, some customer service skills, basic communication, basic interpersonal skills.
Thank you.
Also, several questions from both Greg Pratt and Heather Sharon. In May, the city said they would have 600 people hired for the contact tracing program by mid-September. That included 450 contact tracers, 30 supervisors, 90 resource coordinators. Where do you stand today, and why haven't you achieved it already?
I'll defer to Dr. Artery. I think we've already have been adding to it. And just to be clear, the city itself, through the CDPH, does contact tracing. That's their bread and butter. They've been doing that from day one. I think we're on track, but I'll let Dr. Artery respond.
Sure. So our first and foremost goal, of course, is to make sure that we have the staff that we need to do the case investigation and contact tracing that has been required. And, you know, to date, we've done that largely through the health department, although we've certainly pulled in folks from other departments. We've taken people who normally work in maternal child health or tuberculosis or HIV and pulled them off of their regular duties to really support this COVID work. What this is going to allow us to do is pull some of those folks over time back into their regular roles. It'll allow us to, let the other city staff go back to their regular roles and build this up more. In terms of the specific numbers, because to get into the details, those have not changed. You've heard maybe two numbers that we were talking about, the approximately 500 for the contact tracing and supervisors. That is true, and then the remainder are in the resource coordination hub and the resource coordination supervisors. So as you heard, we've already actually begun that, there's been approximately 100 that have already had some, beginning of job offers here, and it's mid-September. So I feel very good about where we are. We are hiring, and through Chicago Cook Workforce, and then the CBOs will be doing the direct hiring. There's always some bumps in the road in terms of figuring out things like payrolls and figuring out all of the logistics in place, but we are feeling good about where we are.
Not a delay.
No, I think we're really not. Like, this has been, we laid out, even from the beginning where we thought about what the funding would look like and how it would play out, we've always built in and still have the ability to continue to support the important public health need, even if there are delays in contracting along the line. This now we'll be able to sort of ramp up these new folks and ramp these down as long as we can keep our metrics up, but we have some flexibility in that space. So I would say we're right on track.
One other question for you from Amy Jacobson. A few months ago, you said your department was required by law to count COVID-positive antibody tests. Then a few weeks later, you announced that you are not counting those test results. Why not? And wouldn't that give the city a better positivity rate?
So let me clarify that. So first of all, any positive or negative COVID test result, whether it is an antigen test, whether it is a PCR test, whether it is an antibody test, is reportable by law to the health department. However, antibody tests, and just to remind people about those, because not everybody has that, an antibody test is the blood test that lets you know whether you have previously been exposed to COVID. Those are not counted in terms of our cases of the day. They never have been, because you would have somebody get a diagnostic test, in May. If they got an antibody test now in September, we would not count those people twice. So we count the diagnostic tests. That's true at the city level. That's true at the state level. We keep track of the antibody tests because they help us understand things like, for example, we've been working in some of the long-term care facilities to understand what percentages of people may have previously been exposed to COVID. There's some work with other partners to understand what that looks like at a neighborhood level. But in terms of public health intervention where we report out on cases, it is diagnostic cases, and it does not and has not included antibody test results.
One more for you. Wisconsin. Several people are asking about this. Are you expecting Wisconsin to be re-added to the Chicago emergency travel order list soon, as in tomorrow?
Right. So we will, as you know, on Tuesdays is when we make our announcements about the travel order. Certainly, we are watching Wisconsin with huge concern. They had their highest ever number of cases of COVID reported last Thursday. They've had percent positivities in the 13 to 17% range. What we have done, like we did for Indiana a few weeks ago, is where there's one of the states that's directly bordering, we want to make sure people have enough pre-warning about this. So the official announcement on this will come tomorrow, but my expectation is that we will basically put people on alert for Wisconsin, that if they're not able to turn this around, they would be added to the list the following week. But the bottom line is really from right now, if people can avoid the travel, it won't be probably in the formal quarantine order, unless it stays up for another week, but things are not looking good in Wisconsin broadly, and my expectation is perhaps the following week, if they can't turn it around, they would need to be added. Indiana was able to make those improvements, did not need to be added. We can hope Wisconsin turns it around, but, more to say, and we will have a separate discussion about everything related to travel tomorrow.
Thank you. Mayor, from Craig Delamore, how concerned are you about the lower than hoped attendance for the Chicago Public Schools remote learning opening?
I'm not really concerned. Obviously, I'm aware of the fact that CPS at the central office level, but also on a school-by-school basis, 4 weeks prior to the start of school and since, have been doing extensive outreach on an individual basis. This is a brave new world for all of us regarding remote learning, and I'm confident that they will be diligent over these next couple of weeks to make sure that they have outreach. When I was going around the schools for the first day last Tuesday, we were seeing parents just showing up that day to get the devices, to get the packet of information that was available for all students. So there's a lot more that needs to be done when you're talking about remote learning, and I know that CPS is on track and are reaching out and leaving really no stone unturned. They've activated a lot of resources to make sure that young people are connected.
About the census, we have heard stories from census takers that they're not being allowed into some high-rises, including the Hancock building.
Yeah.
And also, are you concerned about low-income neighborhoods not being counted?
Look, I've been concerned about the census from day one. From day one, meaning a year and a half ago when the president first started rattling the saber about putting a citizenship question on the census. I've been worried when we knew that COVID was hitting and all the plans that really called for in-person contact. I've been worried about that. I've been worried about it, and I will worry about it until we get the final numbers. This is our last best chance to make sure that Chicago not only is counted, but gets its fair share of resources from the federal government. So we're doing an all-out effort every single day, assuming September 30th is our last day. The court case is still making its way through the process, but we are operating an assumption that September 30th and not October 31st is our last day, and we are throwing every resource that we can to talk about the census, to connect people up, because I'm concerned about our rate all over the city. Chicago is in the lead or close to it of all the major cities across the country, but we're not even at 60% yet, which says this is a nationwide problem, and we've got to do everything that we can to get our numbers up. And we still have time to turn it around, but we've got to really dig down deep.
Judge Tooman today did not receive the endorsement of the Cook County Democratic Party. There are many who believe it's payback. Payback for being assigned to the Jussie Smollett case. Do you think it's payback?
Look, I'm a lawyer, as you know, and part of my legal career was spent evaluating judges. I think it's critically important that we have the best quality judges on the bench possible, and that they are independent. And I'm deeply concerned, and I expressed my concern to a number of people that were going to be participating in the vote today, that the optics of this are terrible. It looks like retaliation. This is not something that we should have, not in this time, and I'm deeply concerned about it.
I've got a lot, but okay, let me get you one from WBBM because it was sent to me early. They're asking about a firehouse being hit with multiple bullets during a
Yes.
shift change. And the neighbors are reporting large gatherings in a parking lot of a shopping plaza across from the street of that firehouse. Do you believe that large gathering led to the shooting? What's being done to address this ongoing?
Well, I don't want to get ahead of the CPD investigation. There was an unfortunate incident over this weekend, and I have similar information to what you have, which is that a firehouse was hit. CPD, and particularly the Detective Division, is active and engaged in identifying the people who were responsible for that. But more to the point is making sure that the circumstances that created this dangerous condition don't repeat themselves. So we'll have more to say about that as the detectives make more progress.
Two from Fran, believe it or not just two, I think. FOP President John Catanzara has told his members that he expects to get your financial offer tomorrow. He has said that if you're serious about making a disciplinary change that would allow for anonymous complaints without a sworn affidavit, he wants you to eliminate the requirement that Chicago, I'm assuming she means Chicago, he wants you to eliminate the requirement that Chicago police officers live in the city and give them the right to strike.
I'm not going to bargain in the media. We've made our positions on all the issues that Mr. Cannizzaro wants to litigate in the press. We do that at the bargaining table, and that's where we will do it. And we have come at this process in good faith. We are not retreating from reform. The status quo has failed the officers, it's failed the public, and we've got to move forward. We urge, as we have throughout this process, for the FOP to get serious. We can't keep having weeks and weeks where there's no negotiations. That doesn't serve anybody's purposes. We're ready, willing to stay at the bargaining table, to get a deal done, but we've got to get a deal done that reflects our values, and our values are on making sure that reform and accountability measures are in the FOP contract, and clearly we're not going to take a retreat from that.
Whatever happened to the internal investigation of the officers at Bobby Rush's office? Were they disciplined, or was Catanzaro correct? They were asked to be there to protect the congressman's office.
No, that narrative is false. It's been false from the minute he uttered it. The investigation is ongoing. I'm sure you're aware, there's also an evaluation being done by the state's attorney's office. So we need to make sure that we don't interfere with that, but we need to get that done. It's way past time for that to be done. And I would urge all involved to do their work so that can be involved. This doesn't need to be hanging over those officers' head. It doesn't need to be unresolved. I think Congressman Rush deserves to have some answers.
And Fran also is asking, although you resisted calls to defund the police, your budget director says CPD and its $1.8 billion budget will not be exempt from cuts. She has acknowledged that one potential target would be the number of CPD brass earning six-figure salaries.
I don't think that's what my budget director said.
Do you believe there's going to be significant savings?
I think everybody has to participate in this process where we have limited resources and we have a $1.2 billion budget deficit. We have to have a serious conversation all across the board, and there's not going to be one department that isn't looked at, including all of our public safety departments.
Thank you, guys.
Thank you.
Thank you.